Well, the number of female veteran suicides is staggering, especially when compared to their male and civilian counterparts.
That's right. Fox's Alexandria Hoff has details of a new report on how women veterans are in dire need of the mental health and suicide prevention.
Women are the fastest growing demographic of veterans.
But sadly, female veterans are dying by suicide at an alarming rate, increasing more than 24% from 2020 to 2021. That's 4 times higher than their male counterparts and significantly higher than the 2.6% rise for non-veteran women, according to new research conducted by the nonprofit group Disabled American Veterans.
We found that certain factors put women veterans at higher risk for suicide, things like military sexual trauma, which is inclusive of sexual harassment or sexual assault. 1 in 5 women veterans report experiencing intimate partner violence.
Substance abuse and mental health conditions related to their reproductive health are other factors unique to female veterans that contribute to their staggering rates of suicide.
And when you layer all of these things on top of exposure to things like diagnoses like combat-related PTSD, it really does become the perfect storm.
The organization's report identifying what they call critical gaps in the Department of Veterans Affairs, offering more than 50 legislative and policy recommendations to improve access to gender-specific mental health care for the more than 650,000 female veterans using the VA system, including better military sexual trauma screenings and treatment, tweaking the suicide intervention model for female veterans, and improved access for women veterans in rural areas.
We understand that some things are, not going to happen very quickly, and things might not happen overnight. Some of our policy recommendations will take some time, but others can be done pretty quickly.
The VA and Department of Defense continues to prioritize the health and well-being of the nation's service members and veterans, providing clinical intervention and focusing on outreach and support from family, friends, and communities.
It's on all of us to end the stigma of asking for help and support when we or someone we know is feeling distressed or anxious or isolated.
If you or someone you know is in crisis, call the Suicide Prevention Lifeline at 988. In Washington, Alexandria Hoff, Fox News.